Severe head injury refers to a significant injury to the skull or brain that results from trauma. It can lead to serious complications, including brain damage, and can be life-threatening. Head injuries can be classified as either closed without a break in the skull or open with a fracture or penetration through the skull. Understanding the types, symptoms, diagnosis, treatment, and potential outcomes of severe head injuries is crucial for effective management and recovery. Overview definition: a head injury that causes significant damage to the brain, skull, or surrounding tissues. Types: closed head injury, no break in the skull. Damage is caused by acceleration-deceleration forces like in concussions. Open head injury, the skull is fractured or penetrated, typically results from blunt force or sharp objects. Causes: severe head injuries can occur due to various incidents, including traumatic events, falls especially in the elderly and young children, motor vehicle accidents, cars, motorcycles, bicycles, sports-related injuries, football, boxing, etc. Violence, gunshot wounds, assaults, accidental injuries, workplace accidents, home accidents, e.g., falling objects. Symptoms of a severe head injury can vary based on the extent of the damage and can appear immediately or may develop over time. Common symptoms include loss of consciousness, ranges from brief fainting to prolonged unresponsiveness, confusion or disorientation, difficulty understanding where they are or what has happened, severe headache, persistent or worsening pain, nausea and vomiting, common reactions to increased intracranial pressure, visual disturbances, blurred vision, double vision, or pupil irregularities, difficulty speaking, slurred speech or inability to speak clearly, weakness or numbness, inability to move limbs or lack of sensation in parts of the body, seizures, convulsions or unusual movements, fluid drainage, clear fluid or blood leaking from the nose or ears. Diagnosis: diagnosing a severe head injury involves a comprehensive evaluation, physical examination, assessment of symptoms, neurological status, and vital signs. Imaging studies: CT scan, the most common initial imaging test to identify fractures, bleeding, or swelling. MRI may be used later to assess brain damage or soft tissue injuries in more detail. Neurological assessment: tests of cognitive function, reflexes, and motor skills to determine the level of brain functions and possible damage. Treatment for severe head injuries may vary based on the severity and type of injury, and it may require immediate medical attention. Emergency care: stabilization, ensuring airway, breathing, and circulation ABCs are intact. Monitoring: continuous monitoring of vital signs and neurological status. Surgical interventions: craniotomy, removal of a portion of the skull to relieve pressure on the brain caused by swelling or bleeding. Burr holes, small holes drilled into the skull to drain blood and reduce intracranial pressure. Skull fracture repair, surgical repair of open fractures to prevent infection. Medical management: medications, analgesics, for pain relief. Anti-inflammatory drugs, to reduce swelling. Antibiotics, if there is a risk of infection. Anticonvulsants, to prevent or control seizures. Rehabilitation: after stabilization, rehabilitation may be necessary to address cognitive, physical, and emotional recovery. This can include physical therapy, occupational therapy, and speech therapy. Complications: severe head injuries can lead to several complications. Increased intracranial pressure (ICP) can lead to brain herniation, where brain tissue shifts from its normal position, risking further damage. Brain damage may result in long-term disabilities, including cognitive deficits, motor impairments, or personality changes. Seizures: post-traumatic seizures may occur days, weeks, or even months after the injury. Hydrocephalus: accumulation of cerebrospinal fluid in the brain, requiring drainage procedures. Infections: Open head injuries can lead to infections such as meningitis. Prognosis. The prognosis for a severe head injury depends on several factors, including severity of the injury. Higher initial severity is often correlated with worse outcomes. Age. Younger patients may have better recovery prospects. Timeliness of treatment. Prompt medical care is crucial for improving outcomes. Extent of recovery. Many individuals can recover fully or with minimal deficits, but some may experience long-term impairments. Prevention. Preventing severe head injuries involves addressing risk factors and implementing safety measures. Safety gear. Use helmets while biking, skating, or playing contact sports. Fall prevention. Implement safety measures at home, especially for children and elderly individuals, e.g., non-slip mats, handrails. Safe driving practices. Seat belts, child safety seats, and avoiding distractions while driving can reduce the risk of vehicular injuries. Education. Raising awareness about the importance of safety measures in sports and at home. Conclusion. Severe head injuries are critical conditions that require immediate medical attention and comprehensive management to prevent long-term complications and improve recovery prospects. Early diagnosis and treatment are essential, and understanding the risks, symptoms, and preventive measures can significantly impact outcomes for those affected.